So my name is Matheson Harris. I grew up in Salt Lake City mostly, from Utah originally, went to school in various places back east after finishing college here, and now I've been back here in Salt Lake since 2011. I grew up in the mountains and love to be in the mountains as much as I can, so I wanted to come back to the mountains that I love. And then obviously all my family lives in this area, and so that's a double bonus. I am an eyelid specialist. There is a term called oculoplastic surgery. It's basically a hybrid between ophthalmology, which is a doctor who specializes in eyes, and a plastic surgeon who specializes in plastic surgery, mostly of the face. So I went to school first. I got my medical degree, so an MD degree. Then I went and did a residency in ophthalmology, learned how to do eye surgery, such as cataract surgery, glaucoma surgery, all types of surgery around the eyes. And then I did a 2-year plastic surgery fellowship in oculoplastic surgery, so basically just doing 2 straight years of only surgeries on the outer area around the eye, surface of the eye, but mainly the eyelids and the muscles and bones around the eyes. That makes us uniquely qualified to work on the eyelids. There's really no other specialty that does as large of a volume of just eyelid surgery as an oculoplastic surgeon. At the end of our training, we've normally done 1,500 to 2,500 of these surgeries before we're even in practice, which is going to be more than really any other specialty. And then day in and day out, we do 20 to 30 of these surgeries every week. So we see a lot of different eyelid problems and have to approach them in a lot of different ways, but that's really our bread and butter and what we do every single day. And we're uniquely qualified to treat and manage eyelid problems. So I kind of came into medicine in a bit of a strange way, I think. What really started it off was art. So I started when I was a kid drawing all the time. It was like all I cared about doing. There was a point when I, at some point, realized, I think artists know how to draw anatomy. So I told my mom, will you buy me some anatomy art books? And she bought a couple of those and brought them home, and I started looking through them and drawing all these bones and things and muscles. And I just got fascinated with that. I thought that was amazing. And then I got thinking about art as a career, and I thought, I don't know if this is really something that I could do for my job. I enjoyed art, but I wanted to do the art I wanted to do and not what other people wanted me to do. And I even thought about doing anatomical art because I was so kind of engrossed in anatomy. I thought it was fascinating. I don't know, at some point as a kid, someone said to me, probably I got a good grade on some test, and they're like, you're smart, you should be a doctor. And so it got in my head like, I should be a doctor because I did good in school. And so those two things kind of just followed me throughout my grade school. I enjoyed anatomy, and I thought being a physician would be a cool job. I grew up with several physicians living around me, and I got to see kind of what they did, and seemed like an interesting job. So I went to college and kind of went into pre-med, and along the way you just kind of get bounced around between different ideas of what you want to do, and very rarely does someone go to med school planning to be one particular type of doctor and they leave still doing that, because you get in there and you start to see what it's really like to do any particular job and realize certain things you're more suited to than others. So I met a doctor when I was in college who was an eye doctor, and we had similar interests. We were at a mountain bike race, and I thought, hey, this guy is out racing mountain bikes on a Saturday, and he also is a doctor. Like, that seems like a perfect life for me. So I thought, I'm going to look into what he does. So when I got to med school, I started doing research in eyes and got super fascinated with it. Wrote a bunch of papers on diabetic retinopathy, something that is super common. And then at some point I had to choose, like, what am I going to do? And I decided I'm going to do ophthalmology, eye surgery, and I'd already made that decision. And then I did a rotation in plastic surgery just as kind of an afterthought, and immediately thought I'd made a huge mistake. I thought, I should have done this. This is so much fun. I really enjoy it. And then I was telling the plastic surgeons, hey, I don't know what to do. I like eyes, I like plastics. They're like, you don't have to choose. There's a hybrid of that, and it's a subspecialty in ophthalmology, oculoplastics. And so I just kind of slid into that pathway and got into my training and had some of the most amazing mentors, doctors who were world-renowned in our specialty. No one else in the world knows who they are, but we all know who they are and respect them. And thankfully, they were the people who trained me, so I got to learn from the very best people, which was such a blessing to me. The rest is history. Went through residency at North Carolina, and then did an amazing fellowship at West Virginia University in Morgantown, where we were the only game in the whole state and in the corners of a few other states. So we saw lots of people from all over the place who had all kinds of different problems, and I came out of there just feeling like I could conquer the world because I'd seen so many difficult things, and just really got lucky with the places that I landed when I did my training. So it was a really enjoyable experience, kind of look on it fondly. But